for your patience. It's wonderful to see you. Aaron, I see you. Welcome. I will unmute you shortly. So it really is wonderful to see all of you today, and it's especially wonderful to see Aaron in his dining room for the second time this week. The first time was Saturday morning when his and his wife Anita's son Daniel became bar mitzvah over Zoom, which really was such a beautiful and joyous event. So first of all, just a huge mazel tov. And thank you for agreeing to come back on with and for Temple just a few short days later. So, you know, I quite often reflect on how fortunate we are to have an abundance of people within the congregation who are just such experts and leaders in their field. And Aaron is one of those people. Aaron Derfel is a journalist for the Gazette. The bio that we sent you had some important pieces in it, so I will share those, but a couple of other things as well. So Aaron is the medical reporter at the Montreal Gazette. He's been an investigative journalist for 30 years across North America. Many of you will know him just by reading the Gazette on a regular basis, but particularly through this pandemic. He was the one who broke the story about the Emanu-El elder care home, heartbreaking and really important story, and has been sometimes getting under the skin, I suppose it's fair to say, of the current provincial government. And as I was looking around, I found an editor's note, Aaron, that I'm sure you're familiar with from your publication back on June 10th, and was talking about how, you know, in some ways, sometimes the reporter becomes the story, which of course is never the point. But what the author, the editor of this piece, Lucinda Chodan, wrote that I wanted to share with you by way of introduction is as follows. She wrote, Aaron Derfel does not have a problem with the Premier or with the CAC. I've worked for Derfel off and on for almost 30 years. He has been the same pit bull of a reporter since the day he started work here. As health reporter, he has been a major thorn in the side of Liberal, Parti Québécois, and yes, CAC premiers, ministers, and officials. Goes on to talk about how he's not partisan. And then finally, and I thought this was a really important closing paragraph and sets the scene, I think, for the importance of the work of journalists in general and Aaron Derfel in particular, and why I'm so much looking forward to this conversation. The last line of the last paragraph of the editor's note is as follows. At a time when we are experiencing two world-changing phenomena, the pandemic and the Black Lives Matter protests, leaders at all levels of government and journalists each have vital roles to play. Ours include asking difficult questions and publishing information that might make people and governments uncomfortable. This is a matter of public responsibility, not of partisanship. And so with those words, I hand you over to our speaker for today, medical investigative journalist at the Gazette for many years and member of Temple, Aaron Derfel. Aaron, it's all yours. Thank you so much for joining us.
Okay, so thank you so much, Rabbi, for inviting me to this discussion. I just love Temple and everything that you do. So I'll just get right into it. I view this, we're about three and a half months into the pandemic. And I view it from a reporter's perspective, not from the perspective of an epidemiologist, although there's clearly some overlap. This pandemic is unfolding in 4 stages. The first stage I would characterize as solidarity. The second phase is questioning. The third phase is trepidation. You'll note that these are not epidemiological terms. These are my terms as a reporter, okay? We're in the phase of trepidation, right? And then the fourth phase would be either a second wave or multiple outbreaks. And this is why we're currently in this phase of trepidation. We're worried, we're all of us justifiably worried about the prospect of a second wave. We've seen this occur in what's still really the first wave in states like Florida and Arizona and California, where they're beginning to shut down again. So it is a serious issue, right? Now, before I launch into the first phase, which is the phase of solidarity, we're going to go back in time. a little bit of an intro into my background. I feel in retrospect that my whole career, it's as if I was inadvertently training for precisely this moment. What I mean by that is I've been on the medical beat for 22 years. I'm a graduate of the journalism program at Concordia. I graduated in 1989. For the first almost 10 years, I was covering a number of beats, City Hall, Aboriginal affairs, and it was in 1998 that I decided to switch to healthcare because I just felt it was so interesting. It was during this time that our healthcare system began to unravel. And I'm not just talking about Quebec. Healthcare systems around the world during this time started to deal with the financial pressures of having to provide care to an aging population. And whether your system is public or private or a combination of the two, whether it's in North America or in Europe, governments around the world are struggling with how to provide healthcare in an efficient way to an aging population. So it's a big issue. And I knew that there would be pressure on the system, so I decided to cover it. And healthcare gives rise to all kinds of ethical issues. A few years into my career as a healthcare reporter, there was this strange epidemic that was running through hospitals in Montreal. There were patients who were coming in, their colons were becoming inflamed. They were getting infected with this new virulent or a new strain of C. difficile, Clostridium difficile. Some of these patients had to undergo emergency surgery. In the end, this epidemic would kill 2,000 people, in Quebec. This is when it hit me as a journalist, and you know that we have these superbugs, that we have these pathogens, that our hospitals are vulnerable to outbreaks, that our nursing homes are also very vulnerable. So even before COVID-19, years before it was on the radar screen, even before SARS, I was aware of it. And at the same time, I'm writing about Montreal hospitals. I'm writing about resource issues. I'm writing about emergency overcrowding. I'm developing contacts with doctors over the years. I must have interviewed, I'm not exaggerating, it must be several thousand doctors, specialists of all kinds, researchers, nurses, people on the front lines, experts. And so it happens, you know, you almost, after this length of time, you almost become an expert yourself as a reporter on the system, not the medicine, but the system, the healthcare system, and the shortage of resources in the system, and all the reforms that the system has undergone, understanding the details of that. And so when COVID-19 enters Quebec, I mean, initially it struck British Columbia. The first death occurred in British Columbia. British Columbia was able to contain the epidemic much more quickly than Quebec. So the story could have been in British Columbia. It just so happened that the story became Quebec. And Quebec was the epicenter, not just Quebec, but Montreal. Montreal was the epicenter. And the outbreaks that I was reporting, the first outbreaks, they were occurring in the West End, in places like Côte Saint-Luc and in Westmount, following several wedding receptions. So it just so happened that, this pandemic is occurring in my city. My city is the epicenter, and I've been training for this moment. So in that sense, I was fortunate, and to give you some perspective, many newspapers, as you know, were struggling. We've had to lay off journalists. Facebook, the duopoly of Facebook and Google, they've become multi-billion-dollar corporations, and professional news organizations have laid off staff, and they've laid off healthcare journalists. So I can't recall, at least in Quebec, I don't know of a currently practicing healthcare journalist who has more seniority than I do. So I was uniquely positioned. It just happened to be that way. So we'll talk about that phase of solidarity. Let's go back in time to say February. We knew that during this time, that of course there was the epidemic in China and Wuhan, and then it had spread to South Korea and some other nations in Asia. And I think the North American public, we really justifiably were shocked when we saw that Lombardy, northern Italy, became overwhelmed, right, with these cases, that their ICUs and emergency rooms were packed. This is what really shocked North Americans, right? We saw that. Prior to that, there was Iran, but in Italy, we saw the TV images, right? We saw the patients with these oxygen bubbles over their heads, and that there were ER doctors who were dying. The horror of that sunk in for us as North Americans. And our healthcare system, and I remember going to the Jewish General Hospital, the fear then was clearly that our acute care hospitals might be overwhelmed, because that's what happened in Italy. And there were nursing homes that were overwhelmed too, but the media focus was primarily on the ICUs and the ERs. So authorities here, in retrospect, they had miscalculated. They devoted so many resources to the hospitals. What they did is they purposely ramped down the number of elective surgeries and other procedures in the acute care hospitals to give these institutions plenty of leeway, plenty of resources to deal with the pandemic should it strike the hospitals. Instead, the pandemic wave hit the CHSLDs and overwhelmed those institutions. During this period, and it's February, even the beginning of March, the World Health Organization would declare COVID-19 to be a pandemic on March 11th. In February, even March, it was mid-March, there were a few cases in Quebec. And during this time, there was a feeling of great solidarity. Everyone was behind Premier François Legault. And it always struck me, during this time the Premier was giving his daily press conferences. After he left the National Assembly, he was walking down the hallway from the press room. Spontaneously, the TV camera operators began applauding, you know. And as a journalist, I couldn't fathom this. I couldn't understand why they were applauding him, right? Because my philosophy as a journalist, certainly on the health beat, it's always been to probe deeply into the problems of our system. I'm not a cheerleader. I'm not involved in promotion. Our healthcare system is under enormous strain. And I think the public wants me to be that pit bull of a reporter to expose the fault lines in our system, all the problems in our system, right? The areas where our system is being neglected. It's not to write odes to the Premier or, you know, to the government. So that I remember when I saw that the Premier was that they were applauding, I thought that was a bit unusual. So it was during this time that I began to write my Twitter threads. And Twitter, as you know, it's a social media platform. In general, I'm a bit wary of social media, justifiably, because there's so much trolling. I do have a Facebook account, but I use it to a limited extent. And I had opened up a Twitter account, 10 years earlier. I didn't really use it that much. What happened during this time is my editors would assign me stories to write, and I'd come up with my own stories. But I felt that there was a story that was missing. The story was Montreal had become the epicenter of the pandemic. Nobody saw it, but I saw it. And why did I see it? It's not because I'm particularly gifted. It's because I'm the only health reporter, right? And I'm like focusing, right? So what I started to do during this time, I started to ask questions in my Twitter thread. I just started to do these daily updates via Twitter after I did my 2 stories a day for the Montreal Gazette on my free time, because it was a need that I felt was being unmet. I would write these nightly Twitter threads. So in a sense, I was writing like 3 stories a day, and I was doing it, and I'm still doing it on my days off, on weekends. I feel duty bound. And I'm not getting paid for that. I feel compelled to do it. I have no choice but to do it. If I don't do it, I feel guilty. So, so in these Twitter threads, I started to ask questions about the missteps, some of the things that Santé Publique, some of the mistakes that they had made. And I started to compare Quebec with the rest of the country, with other jurisdictions. During this time, there were people who, on Twitter, who were upset with me for daring to criticize or to ask tough questions. And this was during that solidarity phase. And but I was doing what I've always been doing, which is to ask those tough questions, right? So phase 1 ends, the solidarity phase ends more or less about the time when around the time that I wrote the story about the residence Heron. It was after that story emerged. I mean, that story has come to symbolize not just that the pandemic in Canada has affected mostly elder care homes, right? That's true, overwhelmingly. But it's come to symbolize justifiably everything that authorities have done wrong in dealing with the pandemic. It was so shocking. It was after that story that the journalists wised up, and journalists started to ask tough questions. And we're still, in a sense, in that phase. It is our role as journalists to hold elected officials accountable, and not just elected officials, you know, career civil servants. In this case, it would be Dr. Horacio Arruda and Dr. Mylène Drouin, who's the head of Santé Publique in Montreal. So to take you back to the residence Heron and how I had to deal with it, as a journalist, you come across truly horrific things. You observe things. Some of these things are just, you know, it's hard to absorb what you sometimes see. You want, as a journalist, to maintain not a clinical detachment. This is what a doctor has to do, obviously, but as a journalist, you maintain a journalistic detachment, but you're still human, and you're in this pandemic. The way I've tried to resolve that over the years is, and it picks up on what Rabbi Grushko was saying, I fall back on the investigative techniques. I view every story as a mystery, and it's like I'm a detective, and I'm trying to solve the mystery. So by focusing on the mystery, you're so focused on that, it's easier to maintain that detachment. So I always feel I'm missing something. I always feel I don't have the full story. Even when I have what I think is the full story, I'm waiting to be proved wrong, right? I never feel I have the full story. Furthermore, it is essential in my journalism to back up my reporting with data, with documents. The more documents I can get, the better. So, which brings me to the Heron. So I have, as I mentioned before, I've interviewed, you know, thousands of, I should have kept account, but it must be, you know, more than 10,000, maybe 20,000, you know, healthcare professionals over the years. And I've developed a network of trusted contacts, because it's very important for me to keep my sources. And in our healthcare system, following the last reform of the previous government, people felt that that this omerta, this culture of secrecy, pervaded our healthcare system amid very significant cutbacks, and in which during this reform, lots of middle managers lost their jobs. and our healthcare system became like a jigsaw puzzle of different regional health authorities. Montreal used to have one regional health authority. Now we have 5. And that worked against us in the pandemic. There's no doubt about that. So I remember one night, and to be a reporter, you work your shift, but it's a vocation, because at least it is for me, because you're getting calls on the weekends from your sources, and you can't tell them, hey, listen, I'm on my personal time, I'm on my sacred time, don't call me, right? No, you have to take the call, and you have to speak to your sources, and you have to almost, you listen to them, because they have lives, right? There's been a death in the family, so you talk to them about their loved one who's died. So anyways, this doctor calls me up, and by the way, this is a bit of a scoop for you guys. This is the first time I've actually inadvertently revealed that my source is a doctor. Anyways, this doctor calls me up late at night, and he tells me about the heron. I just can't believe what he's telling me. This recalled what was going on in northern Italy, where there were these institutions, these long-term care centers that had been abandoned, and even in Spain, that the staff were so scared. They were coming down with COVID-19. They were so scared that they just started leaving the institutions, and these elderly, vulnerable residents were left on their own to suffer and to die. I couldn't believe it. I just couldn't believe it. And he was telling me that the institution had been placed under trusteeship. And when police showed up and public health officials showed up, they discovered the residents, well, there were 2 residents who had already died and they were in their beds, but their deaths had gone unrecognized. There were some residents on the floor. There were residents who had not, their mouths were so dry that they couldn't even speak at first. There were residents who hadn't been changed, and they were in their feces. So I remember that night, I thought, well, I have to obviously do this story. I didn't sleep well, but I remember telling my source, I need documents. It's not enough for you to tell me this. I need documents. Because as a journalist, you just can't rely on your main tool is the interview, but you just can't rely on the interview, because people sometimes lie, they have a selective memory, So the next day, the source very early emailed me some documents about the situation and on the West Island. And the death toll at the Heron inexplicably was 2 deaths. I couldn't understand that. Why was it just 2 deaths? I was told that the more people had died. So I pursued the story and found out that I reported incorrectly. Turns out that there were 27 deaths. The next day, the premier, he came in on his day off after the story appeared. It was just like it caused a shockwave, right? When it appeared, my phone, I was getting these notifications every second on Twitter. People were pointing to the story. And so the premier had scheduled a day off on Saturday, but the story appeared and he had to come and he had to address it. And I was worried, I was really worried that I was going out on a limb with my story, reporting that there were 27 deaths, contradicting the official death toll of 2 deaths. But I was basing it on, I had spoken to the adult children of 6 or 7 residents. And they had said that their parents had died, so already you have more deaths than 2. And they were saying that there were funeral vans that were leaving quite regularly every day, so that's more than 2. And I spoke with a worker who gave me the figure of the 27 deaths. And usually each month, this facility, an average of 2, maybe 3 people would die from natural causes. In a short period of time, 27 people had died. The next day, the premier tweets, I'm going to be addressing the Heron. He comes in, and it was like a 1 o'clock press conference. Something, oh my God, he's going to say, there's this story in the Montreal Gazette that is grossly inaccurate, very irresponsible. No, there are not 27 deaths. There are just 2 deaths. but in fact, he said that there were 33 deaths, no, 31 deaths. And then I felt, okay, simultaneously, I felt as a reporter relieved that I had not erred, but also I felt sickened, like the pit of my stomach, that this was even worse than I expected, that I had reported. And so immediately after that story, you have the questioning that begins. And this is when we're in the thick of the pandemic, when cases are ratcheting up, the deaths are ratcheting up. I mean, it would be, in May and April, that's when that period where you got the cresting of the epidemiological wave in hospitalizations and in deaths and in cases where it's running like wildfire through the institutions, through the CHLTs and the seniors residences. And during this time, reporters are beginning to question the premier. The premier doesn't like this because he was enjoying, even before the pandemic, he was widely popular, and he was almost elevated to this kind of sainthood during that first phase, that phase of solidarity. And suddenly reporters are asking him the tough questions. And he didn't like that. So one of the things that I've done, and I think this is where I think I upset the premier. It's not for the reasons that he claimed he claimed falsely that I accused him of lying. I never in my reporting accused him of lying. At one point, he kept saying that the Quebec was carrying out 10,000 COVID-19 tests a day. But I was looking at the government's own figures. It was 5 or 6 or 7,000. And I was calling him out on that. When he was comparing Quebec favorably to Germany, I produced a Twitter thread fact-checking the premier vis-a-vis Germany. This is what I'm trying to do as a journalist, is to fact-check the premier and to report the context and to ask the tough questions. What I think probably rankled him the most was we were at the peak of the pandemic when there were so many cases, there were so many deaths. Suddenly he mentions one day, he pulls out a chart. Okay, he's not a doctor. He's a former entrepreneur. He pulls out a chart and he announces these arbitrary dates: May 19th to reopen stores in Montreal, and what's his justification? He's not citing World Health Organization guidance. And he's not the public health director. Next to him was Dr. Horacio Arruda, who didn't say a word. The premier, he lifts up a piece of paper and he shows a chart that purports to show a stabilization of deaths outside the CHSLDs. That was his criterion, his sole criterion to loosen the confinement measures. And he set arbitrary dates. And I produced a Twitter thread that said, there's no jurisdiction in the world that does this, that's done it. Even the Trump White House hasn't done that. And then I think the day after I appeared on a radio show in French. And it was shortly after that a poll had come out that revealed that Anglophone Montrealers were more worried about the pandemic than Francophone Montrealers. And this was because the pandemic first hit largely Anglophone areas of Montreal. And so, these Montrealers knew people who died from the pandemic or were infected. It was understandable in my mind why Anglo-Montrealers might be more worried. I didn't write that story. The premier was asked about that story at a press conference, and that's when he accused the Gazette of fear-mongering, inciting fear. They're saying the Gazette has a responsibility, and that's when he mentioned me by name. And so I was very uncomfortable with that, and I had hoped that he would move past it, and I continued my reporting, my tough reporting on the pandemic. And I was pleased that a lot of Francophone journalists and the Fédération Professionnelle des Journalistes du Québec rallied to the defense of freedom of the press. But it was troubling. It was very, very troubling. And if you look at other jurisdictions, like in Belgium, the public health director holds the news conference. The politicians are absent. In British Columbia, it's Dr. Bonnie Henry. She's a career civil servant, a brilliant public health physician. She holds the daily press conference. The premier very rarely is present. It's interesting that the two populist governments in Canada, Ontario and Quebec, you have the premiers who are front and center. So we're still in that phase where we're questioning things, but fortunately, and it's a credit to everyone here at Temple and across Montreal and across Quebec, people are largely, they've been staying at home, they've been working from home, they've been maintaining social distancing. So the numbers have dropped dramatically. This is truly heartening news. But the coronavirus is still out there. In the last 4 days, Montreal has had an average of 30 new cases of COVID-19. You still have outbreaks. There was an outbreak in a farm on the South Shore not too long ago. There have been outbreaks. There was an outbreak in a prison. There will continue to be outbreaks in hospitals, and there will continue to be outbreaks in the long-term care centers as long as we don't have a vaccine. And the most optimistic guesses are that we'll have a viable vaccine in some time, maybe by the end of the year or the early part of the year. But even if we do, we're going to have to produce billions of doses. No vaccine is 100% protective, and it'll be less protective for the people who need it the most, the elderly, whose immune systems are not as robust as younger people's. So even when a vaccine is there, well, I'm getting ahead of myself, but we're getting into phase 4. So let me just hold off on that. Right now we're in this phase of trepidation, where things have calmed down considerably. But a lot of us, and it's surreal, because it's now summer, the weather is great, and you go outside, you see people, but the coronavirus is out there and it's invisible. And we're all fearing a second wave. And that fear is justified because Iran has clearly gone through, is in the midst of its second wave. There's a province in Iran where, for whatever reasons, there was a lot of this disregard of the public health measures, and the coronavirus came roaring back. And then the United States, there are some states in the Sun Belt, like Florida, the Carolinas, Arizona, that where they reopened, and especially reopening nightclubs and bars, and people have gone bar hopping, and then they find out that they're getting infected, and younger people are getting infected. And something that people should know: there is this phenomenon of the so-called long hauler, someone who appears to recover from COVID-19, but then who suffers months afterward from serious symptoms, headaches, and increased heart rate, and other symptoms, right? So this just again highlights just how scary this disease is. And so we're in this phase where we're all worried. And today, the Quebec government announced that wearing face coverings is mandatory, will be mandatory in the public transit system. So we're trying to head it off. We're trying to head off the second wave. My approach as a journalist is always be, professionally, you're always trying to be ahead of the curve, trying to be ahead of the competition. Not the epidemiological curve, but ahead of the curve in your reporting. It so happens I'm trying to be ahead of the epidemiological curve too. I'm trying to see where the pandemic is moving, where are the weak spots, where there are the fault lines. And this pandemic, this is the case I'm sure with every pandemic, it exposes the inequalities in our society. It just does it. So we see that it's in neighborhoods that have lower incomes, where you've had more cases. So yes, Côte Saint-Luc is a neighborhood with an average higher income, and that's the exception to the rule. But generally speaking, it has really hit hard the lower income neighborhoods, exploiting weaknesses in our system. And so what I'm doing right now, and I produced a Twitter thread just last night, after the government resumed publication of the daily data. That was a story that I tackled last week. I was on my vacation. I was incensed when I found out that the government started to withhold. It almost reminded me of what Trump was saying. You're saying, look, if you test less, you have fewer cases. So here the government was going from reporting the data every day to deciding that they're going to report the data once a week. And that conveys the message that somehow the pandemic is less urgent. It used to be urgent because it was they were releasing the data every day, and suddenly they're releasing the data once a week, but the pandemic is still among us. So I really went on a Twitter rant. It could only be described as a Twitter rant when I found out about this. And then the next day, because of my Twitter rant, there was a source in the Institut National de Santé Québec, read it, and he contacted me, and we were speaking on the phone. He's telling me, I really don't like you, or I really didn't like some of your earlier reporting, but I agree with what you're reporting right now. So that's when I said, okay, great. Now give me documents, give me anything you can get your hands on, give me emails, give me memos, give me something. And he was worried about being fired. So because I could rely, eventually he did give me these documents that show that the decision to switch from daily updates to weekly updates was largely a political decision, right? It was not an epidemiological public health decision, it was a political decision. So I reported that, and then the new health minister, Christian Dubé, to my pleasant surprise, he's following me on Twitter, and the very next day, the government announced that that they're resuming, that as of yesterday, the daily updates would resume, and I was among a group of reporters. I wasn't the only reporter that was writing about this or denouncing it, because this, Quebec would have been the only province not, to switch to the weekly updates. So the updates have resumed. I'm now able to track the pandemic better. And so what I'm really worried about is that we're seeing younger Montrealers, up to the ages of 29, a greater percentage coming down with COVID-19. They're bar hopping, and it's clear that if the coronavirus is in the bars, that the bars are breeding grounds for the coronavirus. And this is a weak spot. So this has been my latest focus has been to write about that. And even though I'm on my vacation, again, I feel duty bound. And which then brings us to, and we're still in this kind of phase 3 of trepidation. How is this going to play out? We're going to have these little outbreaks here and there, and then the final phase is phase 4.
And I'm going to interject just for a moment and ask just to be mindful that we leave a good 15 minutes for questions at the end. But I don't want to lose phase 4, so run with it.
Yeah, so I'm just gonna, I'll end it like very, very quickly, phase 4, because I can't predict the future. But the phase 4 is that we're going to be faced with a second wave. We're going to be in, that might even be deadlier than the first wave. That was certainly the case with the 1918 pandemic. The second wave was deadlier than the first wave. That was a flu pandemic. This is not the flu. It's a respiratory illness, but it's not just a respiratory illness. It affects the blood system too, and a host of other systems, neurological problems, etc. So it's a trickier virus. We don't know how it'll play out. What I can write about, this is what I do know about. I know that our healthcare system is still very vulnerable, and that there are a lot of cancer patients whose surgeries had been put off, and they're now, and their cases were semi-urgent, but now their cases have become urgent. So the worst case scenario is that the pandemic strikes when the seasonal flu strikes, which is in the fall, and we'll be hit with a double whammy at precisely the same time our healthcare system is exhausted. And that's really the big concern. So so that's something I've written a little bit about, and that's what we're all worried. I can tell you that hospitals, what they're doing, they're building some excess capacity. They're building spaces where they can, because they're worried. They're worried about the second wave, and certainly Dr. Horacio Arruda has been honest about that. They're really worried, and it's better that they take the prudent approach. If it doesn't happen, great, but if it does, we'll be prepared. So with that, I'll be more than happy to answer your questions.